Hi, I'm Dr. Gukhool. I'm an emergency physician here at Elite Care. I went to medical school in Kansas City, University of Missouri, Kansas City. I went to residency in Delaware. I did a combined residency in internal medicine and emergency medicine, and I was tired of winter. So I moved to Houston 15 years ago. Yeah, I moved to Houston 15 years ago, and I live down here with my kids, and yeah, we love Houston. When I went to residency, I did a combined residency in emergency and internal medicine, so we did both. But at the end of the day, I had to pick one, and emergency medicine just seemed to suit me better. I think one of the main reasons I chose emergency medicine was I didn't want to be the guy on the plane that when they asked for a doctor that I just kind of put my hand down and wasn't able to take care of it, or somebody anywhere that didn't at least have an idea of how to take care of a problem. Yeah. So when I first started, I came down, I worked at UTMB, I've worked in a bunch of the hospital systems here, Bentab. I really enjoy that, and in some respects miss that aspect of emergency medicine, the procedures and traumas and all those kinds of things. But, working at the hospital was difficult at times just because of the breadth of the patient experience that I was a part of. Seeing how people were struggling and were suffering in many cases, and sometimes in ways that I would hope that I or another doctor could help with, but we just didn't have the time. When you're in a situation where the staffing and the demand is such that you have to ration your time with patients because you know that there's somebody waiting, you know that there's somebody that's waiting that could have a life-threatening emergency even while you're talking to this person that sprained their ankle. You can't dedicate enough time to them to discuss those things, and because you have to move on. And so having that time to have that interaction with patients has been one of the best things about this job at Elite Care. When I'm not caring for patients at Elite Care, I like to play hockey because it's the best sport. I prefer team sports just because I just like the interactions of different people towards a common goal. And I started playing goalie because I like the focus. I like the being a part of the team, but being at the end of the day, the last person that has a say on what happens with the puck going into the net. At Elite Care, we have things in a way that we're able to dedicate as much time as the patient needs to make sure that they understand what our concerns are and help us to understand what their concerns are. It's been nice to be a part of an organization like this. I mean, I like the problem solving. I like the meeting people and being able to engage with people in all sorts of walks of life and hearing their stories so that, again, you can make a difference. I mean, it's a little difference, but to that person, hopefully it means a lot. And this is the way I thought medicine should be practiced. I care.